For those of you that have jumped on, welcome. Good morning. Happy Friday. It's 9 o'clock. I think there's still a few participants trickling in, so we'll give it maybe one more minute before we get started this morning. So just sit tight, and we'll give everybody a second to get in if they're planning on joining. All right. Well, welcome everyone to AEM Workforce Solutions live question and answer session related to just practical response to COVID-19 in the workplace. I'll do some introductions to the team, a few housekeeping items, and an agenda. But I think just to kind of kick this session off, just to kind of let everybody know that really we decided to get together today based on just a flood of calls that we've seen from clients, non-clients in the last, I would say even 3 weeks, both in the Metro and Mankato areas and other areas in our region, as employers really start to face real life positive tests in the workplace and trying to respond to just the variety of things that we all need to be thinking of and being proactive, things that are regulated, areas we need to make sure we're in compliance and working with employees correctly. So today's session is really intended to be just a high-level overview, and the bulk of our time today we hope to spend doing just live question and answer with those of you participating in the call. So let's get started. Again, a couple housekeeping things before we get going. We'll just be monitoring any of the live questions, so feel free to submit any of your questions as we're meeting today in the Q&A box. We'll try to answer as many as we can. I may be trying to summarize similar questions. Feel free to use the chat function if you're having any technology or sound issues. We'll make sure to get that fixed for you. And then just keep in mind that we'll be sending out a short survey after the session, just a few quick questions. So feel free to take the time to fill that out when you're done today. And with the Q&A, we have some really short overview conversations that we're going to have before we move into the live Q&A. So just know, feel free to submit your question anytime, but we'll be saving those till after we just get through the brief overview. As with any information related to COVID-19 and COVID regulations, we just want to make sure that we stress, I can't stress enough, that this is a continually evolving, changing, and dynamic situation. So be sure, what we talk about today on July 17th could be very, very different on Monday. So make sure you have those resources to keep yourself informed as things change. So I'm really excited to announce some of our senior HR specialists from our AEM Workforce Solutions team. So again, my name's Leah Davis. I'm the president of AEM Workforce Solutions. And here with us today on our live panel is Brenna Ramey, Brittany Bauer, Tamara Hastings, and Megan Schwanz. And so our whole team has lots and lots of years of real life in the field HR experience, and we spend most of our time talking with clients and helping internal HR with all types of policy, program development, compliance, process, and so hopefully we can bring a lot of value today from the wide variety of clients and situations that we've seen over the last few weeks and months related to COVID-19. So as I mentioned, we'll do some very high level overviews of a few key areas that I think it's going to be really important to have in mind as we tee up our Q&A session. And so we're going to be going through some high level of the Minnesota Human Rights Act and some of the accommodation process implications of those things. Tamara will be talking about workplace safety and some OSHA considerations. Megan's going to speak a little bit to just having a practical response plan in place in your organization, and then we will open it up for questions. So Brenna, I will kick it to you for the Families First, Minnesota Human Rights Accommodation, easily summarized in 5 minutes, right?
Yeah, no big deal. There's nothing there to unpack at all. And I'm sure, like the rest of us on our team, you all are looking forward to January 1st of 2022, when Families First is not a regular part of your language all day, every day. So I know you all have heard much about this, and employers across the country and Minnesota have been digging into this for months, but we just wanted to spend a couple of minutes and talk about it, and primarily just to get us all on the same page and make sure that everybody's looking at it the same way. And before I dig too far into it, I do want to say, so what you're seeing on your computer screen is a flow chart that AEM Workforce Solutions put together right initially when Families First came out, and we've kept it up to date. Don't worry about furiously taking notes on this. At the end of the presentation, you will get the whole slide. Everything you're seeing today, you'll get the presentation. And included in that will be a link. These forms that we're showing you, specifically the next couple of ones, are available for free on our website. So you can have the link in the presentation when we send it. So don't worry about reading through each thing and taking notes on that. We'll provide that for you right after the presentation is over. So when we talk about Families First, this was one of the first waves of legislation that was passed before the CARES Act, and then we see the HEROES Act and PPP. And Families First really did a couple of important things. The first thing was it had two main priorities, and that was to provide pay for employees and then provide compensation back to employers for a situation when somebody was exposed, had symptoms, or had a positive result of COVID-19. And I think it's important that employers understand the purpose of that was to prevent spread. So this is less of an economic stimulus package, and this was more of a how do we prevent people who could be sick, are sick, were exposed to somebody who is sick from going into the workplace and continuing that community spread. So that's really that emergency paid sick leave piece of the Families First Act. The second thing that the Families First Act did was look at providing compensation for employees and then tax credits and repayment back to employers that were related to childcare, right? So right after, and all of this seems like so long ago now to even have this conversation, because we're talking about, will school happen in the fall? But in March, school was closed for the first time, right? So we started to see that happen. And Families First said, if somebody can't go to work in the office or work at all because their child care has been closed, or really that was about schooling as well, then we want an employer to be able to provide compensation to an employee. And again, this is more of a stimulus package to say, we don't want somebody to lose their home, somebody to lose their job because they can't work because of out of their control, school was closed. Some important things to note about this, because I know a lot of our clients that we work with regularly and that are listening today are in municipalities or our city governments. And so one thing that's important to understand, even if you're not a city employer, is that city employers are required to provide these paid leaves to employees, but may not actually get the tax credit for repayment for it. So it's some really interesting things in this legislation. And there are very few employers who are exempted from it. So they went through, there's a lot of information out there on our website that can talk to you about who's covered under this. So things that happened after Families First came out was, we know that on the tax side, Department of Labor gave us great guidance on who's covered. There's, I think, up to like 89 questions, FAQs, that can help us understand that. We also saw on the tax side, we saw a lot of good and more in-depth information that came out that talked about So how do you actually claim those credits, right? So a couple of months after Families First went into effect, which was essentially on April 1st, then we saw on the tax side, oh, actually it only covers, you can only be reimbursed if it's kids who are over or under a certain age during the day. So there's lots of things to unpack here, but we just want to make sure that everybody understands major changes are, even if you've never been covered under FMLA before, if you were under 500 employees, you are required to provide Families First paid leaves, which covers the emergency paid sick leave and the emergency expanded FMLA. There is an exemption if you're under 50 to show a business hardship. We're going to talk about that in one of the questions that was previously submitted, so I won't unpack that in depth here now. But there is that small exception. We have yet to see a client actually exercise that, and we'll talk about that in the Q&A about why we don't see it applied very much. So I'd love to talk a little bit about now, what do you do on the next side for actually getting those credits back? And again, a reminder, because this is, I think, what we're seeing now is most of the questions we're seeing are coming in about how do I get this money back now? So I gave it, I understood I was required to provide it to my employees. I just said yes across the board. How do I get that money back? And so again, this form that you're seeing on here, this is available to you for free. It's on our AEM Workforce Solutions website. You don't even have to go find it. We'll just email it to you after this. So don't worry, you'll have this at your fingertips. But it's really important. We're stumbling and hearing across now organizations saying, I provided it, but I need to apply for this exemption because we can't afford to pay it, not knowing and understanding that they actually get repaid at 100%, right? So no, theoretically, when this system plays out, if you're following the guidelines for what is your documentation process, which Megan's going to talk about in a little bit here, are you following the tax, all of the tax things on it, that if you follow the process, you get fully reimbursed for all of these things. So because it's such a big bucket of how you do that, we're not going to dive into the technical pieces of that today because there's a lot of really good resources out there. And what I would tell you is that if you're not familiar with that, hey, I've never applied for the tax reimbursement, I don't know how to do that, or I can't wait for my quarterly tax filings to do that. Go to our website, we have great resources there. B, on that first slide that Leah spoke about, all of our individual, personal, professional email addresses are on there. You can email any one of us and we can help you navigate that after the presentation today.
Very good.
Okay, so the next thing I want to talk about is what do you do, and Megan's going to talk at length in 5 minutes about what do you do when somebody has a positive COVID test. Tamara is going to talk about at length in 5 minutes, what do you do as a workforce operationally when somebody has a positive test? So I wanted to just approach it from a little bit different perspective. And before we can do that, I wanted to get us all on the same page about the ADA, the Minnesota Human Rights Act, which is the MHRA, and what does this all happen and apply with COVID. So just to get us on kind of a base level foundation together. The ADA is the Americans with Disabilities Act, and many of you are familiar with this. This is for if you have 15 or more employees, you've always been covered under the ADA, and you have to participate in the interactive reasonable accommodation process. So what's really interesting is that the MHRA has never required in the language, the Minnesota Human Rights Act is what covers everybody else. So even if you're not covered under the ADA, which is a federal legislation, the Minnesota Human Rights Act does cover you. It prohibits discrimination on any protected class, including disabled employees. When we speak about COVID, COVID's a medical condition, it could be considered covered disability. But the Minnesota Human Rights Act, even though it doesn't explicitly say you're required to participate in the interactive accommodation, Governor Walz, about a month and a half ago, in one of his executive orders, actually wrote an executive order that said, we are, under the Minnesota Human Rights Act, expecting employers to participate in the interactive process with employees who are discussing with their employer anything related to COVID. So I can't work because I have COVID, I have a symptom, I have an underlying condition. In fact, the executive order that talks about this explicitly says, as does the ADA, hey, an underlying condition that puts them at higher risk if they were to contract COVID, is considered covered, and you need to participate in that conversation. So it's, while the MHRA previously would not have had that, we do know that Governor Walz has said, and there's an executive order, it's not implied, it's an executive written order. If you go to their website and read one of those really exciting ones, it says it right there. So what is the interactive process? When we talk about that, it's important to say that the interactive process is not me interacting with a manager and deciding what we should do for the employee and then just telling them the answer, right? So the interactive process requires an ongoing conversation that has dialogue back and forth between the employer and the employee. And so what we're looking for here is, how do you actually talk about that, right? So we're not just saying, and Megan and Tamara and all of us are going to be talking about this a lot today, that there is not an ability to have clear black and white answers, and if this, then that is always going to be our answer in any of the things related to COVID. Specifically, as we look at the interactive process, it has to be individualized and there needs to be a conversation, right? So you need to be talking back and forth, and you need to be saying, how are we saying, what can we do? What can't we do? Here's why we can't do it. We can't have rules that say we don't let anybody do that, because that's not interactive. That's a guideline and a rule that you need to kind of set aside, which is hard for leaders and managers, and we'll talk about what that looks like. So how does the interactive process relate to COVID-19? And what I would tell you is that it relates in almost every area, because there is no clear, if this is a situation, and it seems like there should be, we have this conversation a lot. It seems like there should be a clear, okay, we can come up with 3 or 4 policies that if we just put in place, that'll answer all of our questions, right? We won't have to have individual conversations to figure out what each employee needs. And the answer is it doesn't, because COVID affects different people differently. What are your pre-existing conditions? I would also tell you that what each person's medical provider says is going to change based on who their medical provider is, right? So if any of you have had employees come in with things yet, maybe you have somebody in the North Memorial Healthcare System. Maybe you have somebody in the Health Partners system. Maybe you have somebody in a local clinic. All of those healthcare systems have different protocols in place and have decided on different recommendations based on their medical opinions, what those systems have decided. So you might not always even get the same answer. So some things that we want you to just be prepared to talk about. On the next slide, there are some really great examples of just simple things to think about. So is the person seeking an accommodation because it's related to COVID, right? So they have symptoms related to COVID, which is going to put them in a families first emergency paid sick leave bucket. Are they looking at, hey, even though we've returned to the workplace, our office has reopened, we were reopened in one of the phases in Minnesota, but I have an underlying condition, and so my doctor has recommended that I continue to stay working from home. So is that related to an underlying condition that's considered under the CDC? They have a doctor's note, then that would be considered an accommodation request under both the ADA and the Minnesota Human Rights Act. And so you need to look at those one by one. Are they worried about risk of exposure because perhaps their spouse is high risk, right? So is it somebody in their family? Do they have a dependent who's high risk? Is it their child? Is it somebody that there's a primary caregiver for? So there's a lot of buckets on this. And what I would say is that this is what, if you ask, I know all my peers and I are going to start nodding our heads here. We're spending 75% of our time with clients and non-clients right now having these conversations, saying, hey, here's the request I got today. Here's the doctor's note I got today. Here's the email or the voicemail message that I got today. And we're spending a lot of time saying, okay, so what's your individual work structure, right? So what role is this in your organization? For example, we have some clients who have manufacturing areas, and so they also have sales managers. So can the sales manager, an accommodation request to continue working from home from a sales manager is different than an accommodation request from somebody who's on a manufacturing line who has to actually be physically present to work from home. So even within the same organization, you need to look at those specific situations differently. So this is an area that even if you've been in HR a long time, we're having these dialogues within ourselves. We're constantly, almost every week, just our team had a call led by Megan this week where she said, hey, let's go through all the questions we've gotten this week to share our working knowledge, to talk about what things are we learning from each other. So this is an area that absolutely, if you're saying, hey, I have a lot of questions, know that you're in good company. And if you feel like, all right, I read Families First, I know everything there is to know about it, I know about accommodations, the Human Rights Act, and you get a question and you kind of sit back and scratch your head, you're not alone. HR professionals across the country are in that same boat. And where this is an area we're happy to help you with. So truly, all of our individual email addresses, again, are on that main slide. Feel free to email us if you're a client, if you're not a client. This is something that we're happy to kind of work with you. And we have a lot of forms and processes that we've got in place from doing this with our existing clients. So there is no one size fits all, except for you need to know Families First applies. If you're under 500, it applies to you. You need to understand that. Make sure you understand that you get those tax credits repaid back. And that even if you've never been covered under FMLA or the ADA, you can't hang your hat on that hook anymore. And you need to know that something in all likelihood covers you.
Thanks, Brenna. Tamara, so let's talk a little bit about safety in the workplace and what are the employer obligations related to environmental precautions and disinfecting and safety measures.
Yeah, good morning. So there's a lot here we can unpack. And again, I'm going to try to go through this really quickly and high level so that we're leaving plenty of time for specific questions and we're leaving that time open to address the concerns that you're experiencing in the workplace. As Brenna mentioned, there's so much here, and navigating all of this, even if you know FFCRA front and back, these areas are gray. The details are just a little bit different on each one, and so it's challenging. So we'll go through these kind of high level and then leave the time open to answer the specific questions. So responding to a positive case. So what we have here is a flow chart, and similar to what Brenna said, you're going to get this flow chart. So please don't focus on trying to jot all of this down. But some important things to notice. So what we're seeing, and as you can expect with a positive COVID diagnosis, once you're contacted, what we're trying to avoid here is a bit of that panic spin, right? Because all of a sudden you're going, okay, I think I know this, I think I know what to do, or maybe you're not sure, and you're trying to figure this all out very quickly. Who do I contact? What do I do to go through this process? Do we need to close? Do we not need to close? Do we need to clean? And how do we need to do that? And so this is going to help you just go through that step by step. But that being said, even with this, there are some things that you want to have in place beforehand so that this can then assist you as you walk through the stages. So that to prepare section is going to be really important. So have some planned communications. And honestly, at this point, I would even recommend have those communications ready to deploy. Have them planned out and written, because you don't want to be doing these when you're panicking and trying to figure out what else to do. When you have time beforehand, hopefully you have some time now to sit down and write those out and have them just ready to go should you have a positive case. And so that way you're writing them with a clear, cool head and you're being very objective about it, and potentially have time to have other people review those as well before you have to send those out really quickly. So, who are you going to contact? Is it customers? Is it just internal employees? Is it people that are really close to the employee that had close contact? So just think through those things before this case comes up, because that's going to be really important. And then the next step is, so immediately after diagnosis. One of the first steps is, let's say the employee's in the workplace when you find out. They get the call that they're positive, they're in the workplace, they let you know. So now what are we going to do? And thinking through that again beforehand, so that you have those steps in place. How do you get this employee out as anonymously as possible and with their dignity intact as much as possible and without contact with other employees? And then, how do we keep other people from knowing? How do we keep the gossip down? Things like that. And in a lot of cases, if it's a smaller organization, they're going to probably know, all of a sudden this person is not in the workplace. Just make sure that information doesn't come from you. you know, if they say, hey, I know it was Sally that was diagnosed, you don't have to confirm that information. You don't have to say that. Just let that go and move on. And then going forward, so the 1 to 2 hours, the 2 to 5, 24 to 48, this is going to include a lot of, you know, having meetings. So who are you going to have in those meetings? Who do you want as part of that team to help you work through this? How are you going to handle the other employees? Are you going to close? And again, I'm not going to go into that in detail. Those are big questions, and some of the questions in the Q&A are going to address that as well. So we'll get to that in a minute. But then, you know, the 24 to 48 hours, how are we going to clean? There's so much to really consider. So use this timeline. It can be really, really helpful. Just don't store it away. Take a look at it beforehand, just so you've got those pieces in place before this happens. And that way, when it does, you can just take a deep breath and go, all right, I have a plan for this. Now let's employ this plan and go through it. So those are going to be the really important steps for when you have a positive case, just to know what to do initially. And then you'll have some time to figure out, call us if you need to, and figure out, how do I handle this one specific case? Because again, the details are really specific, and Megan will talk through some of that as well. So then we have some of the OSHA considerations. And again, OSHA is huge, so I'm not going to cover all of this, but I do want to touch on some of the things that I think are going to be most applicable to you. So one is that with OSHA right now, there's a lot more guidance than requirements. So what you're not going to find in the OSHA Return to Work booklet is you have to do this, 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 and this. There are a lot of recommendations, a lot of suggestions for things to do. And we'll talk about why that's important in the next bullet. But that's what you're going to find, is a lot of recommendations. So if you're looking for clear-cut answers on what do I have to do in this situation as it regards OSHA, you really aren't going to find a lot of that. So we'll talk through more considerations and things to think about, but there aren't a lot of like, I have to do this, check the box, or it's wrong when it comes to safety and OSHA in this case. It's also really important that you communicate and document your efforts. So what we see a lot is that employers are really thinking through, how do we handle this? What do we do? But it's really also important that how you're communicating that to employees and how you're documenting those. So just quick scenario, let's say you've got someone you're working through a reasonable accommodation with through ADA, and they have a COVID concern. If there should ever be a lawsuit with that later, or some sort of litigation, what's really going to be important there is, how did you communicate your efforts? You know, not just, hey, we put this plastic piece in place to keep people from passing COVID back and forth, but did you communicate those things as well, and the importance of them to your employees? And did you document, hey, here are the things that we did to protect our employees? So make sure you're doing that as well, and you're not just putting all of your effort in to making sure the workplace is safe, but that you're also checking these other boxes that are going to be really important later on, should you have a concern come up. And then OSHA also recommends that you conduct a hazard assessment and outline protective measures for different positions. So this is really important. So if you have someone who's working on the shop floor around many other employees, versus let's say you've got someone working in the office who hardly ever sees anyone, no customer contact, those responses are going to look very different, right? We all know that. So conducting that hazard assessment and what they need for PPE and protective measures is going to be really important for that specific role, because they're going to look very different. So the person who's working all by themselves obviously may need less than the person who's working on the shop and who's around a lot of other people. So keep those things in mind as well. And then making reasonable efforts to determine if COVID-19 is work-related. And here's where I feel for all of you, this gets really tough. So one of the suggestions is to conduct a mini investigation should an employee come up COVID positive. So that sounds like, okay, sure, I can do that, but there are a lot of caveats, as with all things in this, that come up with that. So what you don't want to do as an employer is assume that an employee contacted COVID from going to the grocery store or being out in public. What we need to do from an OSHA safety standpoint is try to determine where the COVID came from. Now, I know if you're smiling or laughing, that's really difficult to do, right? But there are some limited questions that you can be prepared to ask. So you want to make inquiries very cautiously about the employee's work and non-work activities, so that you can kind of determine where this exposure was. Now, this is where you have to be very careful. So here's what you don't want to do. You don't want to say, hey, has your spouse or your child recently been come up COVID positive, right? We don't want to do that. We want to be very careful because these are medical inquiries. And so we're going to potentially violate an employee's right to privacy, ADA, other laws, things like that. So we want to be very careful how we ask these questions. What you can ask is how the employee thinks he or she got the virus, or how they think they were exposed to it. So again, just be very cautious in how you're asking those questions and let the employee provide you with that information. So let's say the employee works completely alone, has no other contact with anyone else, and they come up COVID positive. What's that going to tell us? If they let you know, hey, I just went to a big party last week and everyone there came up COVID positive, that's going to give you information as well. But just being very careful. And again, having a plan when you sit down and talk with that employee, having a list of questions that you're prepared to ask that person so that you've got that almost just like an interview, where there are legal questions and illegal questions. Know what you want to ask, be prepared, so that you can keep that contained and legal, but also get the information you need to help you determine if this was work-related or not. You're not going to know 100%, right? We're just not going to know that. But what we're trying to determine is, was it likely work-related or not? Because if so, you're going to have to fill out that OSHA 300 form and go through that process, which we don't have time for me to go into today. But those are just some high-level things on OSHA. I know we have some specific questions about this, and if you have any as well, put them in the Q&A and be ready to ask those questions, and we can talk through them.
All right, thanks, Tamara. And then Megan, we'll kick it to you. So now we're to the point where employee picks up the phone and says, hey, I'm going in for a test today because I'm not feeling well, or someone that I live with has tested positive. So this gets really fact specific, but kind of walk us through that.
Yeah, so the first thing I want to say is you don't want to be the employer that isn't prepared. Okay, so we've got that flow chart for you that Tamara spoke about. And so use that, review it now so that you're prepared for when that call comes in, because a lot of it is immediate response. So you need to be prepared. Your managers or your supervisors, I think this is one thing that I've seen fall through the cracks. Make sure that they are trained on how to respond as well, because it's likely that they're the ones that are going to have the first contact with that employee who says, hey, I'm not feeling well, or I'm going to go get tested. So make sure they're trained on what to do, the HIPAA privacy rules, so they're not telling everybody in their workspace, hey, so-and-so went home today because he thinks he has COVID. Make sure that those managers and supervisors are trained. Make sure that they're all trained on that COVID preparedness plan. So even those essential businesses, all businesses are now required as of June 29th to have that COVID preparedness plan. There's great resources that the state of Minnesota has provided to you to come up with that preparedness plan document. You all need one, you all need it posted, and then make sure that you're reviewing that with your managers, supervisors, and your employees know as well. So prior to that positive call, you as an employer were likely aware that that employee was going for a test. They called you, said either I'm not feeling good or I've been exposed. And so that employee has likely already been out for 24 to 72 hours pending those testing results. So in your initial call with them, you should provide them with, okay, here's the negative scenario and here's the positive scenario, just to kind of put them at ease. And when they're calling to tell you that they're going to get tested, this likely might be their first COVID call. So we need to remember that even though we're taking these calls all day, maybe as HR professionals, this employee might be scared, might be panicked. So taking the time to listen to them, just kind of calming them down, amp up your listening skills. You may get one that doesn't care. We've had those too. They don't care, but you never know what you're going to get. Every call is going to come in differently. So just be prepared, talk it through with them. But I have seen that it's important to give them those two scenarios. A negative, this is what that looks like for you. A positive, just kind of blanket that. This is what that looks like. Either way, we're going to work through this. Everything's going to be okay. When someone just goes to get tested, there's no need to alarm other employees at that time. The work site, the employees that are there, they should all be following those CDC guidelines and your COVID preparedness plan anyway. So taking those safety and hygiene measures already. And again, just making sure that your managers, know all of those guidelines and they're following those health and safety guidelines. So then that employee calls back and it's positive. So again, you're gonna stay calm, you're gonna listen to them, and then again, let them know they're not alone. So we're gonna work through this. And are they on site? Okay, confirm their location. If they're in the workplace, as Tamara said, you're gonna safely exit the workplace very discreetly. And then ask them what day per your healthcare provider or the state health department did they say you can return? Because our team has also said, it varies. We're seeing 10 days, we're seeing 14 days. So get that date just so you can start tracking. You're going to want to start tracking that leave. Let them know that per your COVID preparedness plan, you're going to send out a notification to all employees at that work site to let them know that an employee has tested positive. You're not going to give them anybody's name, so make sure that they know that all of their information is going to stay confidential with you and the company. You're also going to let them know that you're going to contact anybody that they can identify that was exposed in the workplace. So in the workplace, that's not just employees, vendors, visitors, anybody that they had at least 15 minutes of contact within 6 feet in the 72 hours prior to the onset of symptoms. Those are the people that you want that employee to target and take down their names. You're going to make separate contact with those identified individuals. And again, you're not going to drop any names. You're just going to give the same spiel on there was an employee in the workplace that tested positive. You have potential of being exposed. You were named. That employee is going to ask you, what should I do now? Your response to them is that you heavily rely on the healthcare provider or the state health department. So just advise them to contact either one of those and go from there, because again, you're going to rely on that information. With that employee, you're also going to then explain their FFCRA rights. Okay, so that emergency paid sick leave is going to come into play. Because again, as Brenna mentioned, we don't want these employees not to tell us that they're going in to get tested, or that they have a positive case, or that their household was told to quarantine. We need to know, and that's why the government then is saying we will pay you for that time that you can't be there, because our employees are our top priority, employees and the safety of others. So they've got that leave for them. Let them know that you do, if they get some documentation, send it your way. And you can send them this form that we have here. You can take this information down, but this is just something that we have used with clients. And it's not required that they give you any doctor's note or any notification, but you do need this information per the IRS for the reimbursements. So tell them you're going to send them this form. Don't make it difficult for them to fill out. If they don't have a computer, no way of printing this, signing this, you can take the information over the phone per what they have told you, and then just sign it and say per our telephone conversation. And then you're going to file this away with your tracking information and confidential, it's medical information. So that employee may request to come back early. In my experience, I've had some of those. Again, you just want to let them know that you have to follow that healthcare provider and the health department's guidelines and recommendations. And the safety of the other employees is your top priority. If there are no work restrictions, so employees positive, no work restrictions, they feel good, maybe they're symptom free, and they could telework, you could certainly have them do that. But again, that paid leave is there, and we certainly don't want to require any sick employee to telework. It's our time to be flexible and care about our people. So this slide just gives you how to determine which other employees have been exposed. So you can go through that. The communication with those employees that have potentially been exposed, again, make those separate phone calls. They're going to ask you what they should do, but again, contact their healthcare provider or the state health department. We have two models that were given to you. This is model 1, and pretty self-explanatory, you can take it. This would be sent out to all employees at your work site. Okay, this is model number 2. So, employer will likely get a call from the state health department. Okay, so when that employee tests positive, they will give a manager's name, a supervisor's name, or their employer. So I've had a number of managers get these calls, so prepare them because they get a little nervous when I get a call from the state health department. But they are just going to ask questions on, do you know that an employee at your workplace has tested positive, which I think is great that they're following up on that. And then they're going to ask, what safety measures are you taking in your workplace? Have there been other cases? They will tell you that the employee named 5 people that they feel were exposed. In my experience, they're asking the employer for the contact information of those employees. I would not give it to them. If you don't feel comfortable, I just wouldn't do that, but ask them, may I talk with those exposed employees and tell them to call you? Just so we're not giving out employee information. So.
All right. We really blew through 5 minutes because it's just so much content, but we've got some really good questions, and thank you all for that information. I think it really helps set up some of the questions that we're having come in. So I think there's a couple that have come in just yet today that are really easy, quick answers. So one coming in is, have the executive orders, and this was really, Brenna, during your section regarding the Minnesota Human Rights Act, and are those executive orders still in place? And the answer is yes. So none of those orders have been pulled back. Like the stay-at-home order, for instance, has been eased and pulled back, but the accommodation and COVID-related discussion are still in place. We have a couple questions here about, let's talk about that period of time from employee goes in for a test and is waiting for results. So really quick answer as to one, do we contact, and Megan, you kind of touched on this, but do we have to alert everyone that someone has gone in for a test? And like what should be done in that interim period of time, both for the employee and the employer?
Yeah, so you can tell the employer can tell employees that there was potential exposure, but we are seeing testing. And so I just think to eliminate that panic in the workplace, that there's no need to tell them every time somebody goes in and gets a test. The need is to educate them on what to be doing in the workplace, the social distancing, the wearing the masks if you do that, the hygiene and the sanitizing, because all of those things should be done. So that is where I would focus your time during those 24-72 hours. Focus it on pushing those guidelines. For the employee, if that employee calls and says, I'm not feeling well, or I just potential exposure, I'm going to go get tested, ask them after they get tested, okay, if you are told to isolate, if your healthcare provider or the state Department of Health tells you to isolate, then let me know. That qualifies them for paid leave.
Okay, very good. All right, so Tamara, one of the questions we had pre-session was, are there disinfecting standards that are recommended for workspaces and restrooms? I've had questions from employers thinking, do I need some sort of robot laser beam? That's what is the expectation? What is good enough when it comes to disinfecting standards?
Yeah, I mean, short answer is no, actually. So going back to that OSHA statement that there's more guidance than actual like regulations, there's no one way that you have to clean if somebody comes up positive. But if you go to the CDC website, our best recommendation is to continue following that. There's some really good guidelines on there for how to approach cleaning. I mean, down to even like how to clean soft surfaces versus hard surfaces. What should you be cleaning on a daily basis versus what you should be cleaning if somebody comes up positive. And then also, you know, hard surfaces, electronics, all the different pieces that you're going to have in your workplace. So best recommendation for that is no. If you're looking for one specific way that you have to clean to meet some sort of requirement, it's just not out there. So don't worry about that, but do continue to use the CDC website for their guidelines on how to approach this cleaning, because it's surprising, it's really, really helpful. Even, you know, how to make a certain bleach mixture to set something up to clean it appropriately. So that would be our best recommendation in this case.
Yep. And as with everything in HR, document what you're doing so that you have on record what precautions have been taken, and in the event of an issue, you're getting credit for the, you know, preventative measures you took.
Yes.
I'll just add that I had a client have a couple employees, maybe a handful, 5, track everything that they touched when they walked into the office to create a template for cleaning. And so they wrote down everything that they touched throughout their entire day to help create a cleaning checklist.
Very good. And we kind of beat this question to the punch. So this one's probably okay. One question that did come in today, though, that's a little bit of a caveat that I think I can probably field is, we have an employee, they have symptoms, they go in for a test. For the time they're waiting for the test, that's clearly FFCRA, emergency sick leave. But now employee's test is negative, but they're still running a fever, they're ill, they can't return to work. So just that gets to, yeah, I mean, who knew you can still be sick with something other than COVID-19 right now. So in that situation, employee is using FFCRA from the onset of symptoms until they receive that negative test result. That is FFCRA eligible. Post negative test until they are able to return to the workplace because they're well, you're going to treat that just like you would normally treat sick leave pre-COVID. So just a point there. Oh, okay. So this is probably me too. So lots of questions about the interplay between PPP loans and FFCRA refunds and credits. So what's really important to note, the PPP loan clearly states that eligible payroll costs that are eligible for forgiveness at the end of that loan period, cannot include any payments to employees that are allowed a credit under FFCRA. The word allowed is our key word here. So that means that any FFCRA that's allowed a credit, whether you apply for the credit or not, cannot be used as PPP payroll funds eligible for forgiveness. Because of this, you should, if you have a PPP loan, you should be paying out and applying for refunds for all of those FFCRA payments, because they will not be eligible for PPP irregardless. And then PPP will, anything other than FFCRA that's eligible will fall under your PPP payroll costs. So hopefully that clears some of that up. That was very, very confusing when some of this initially came out. let's talk through, we had one question come in that even threw in a child with an underlying health condition. So can we tackle, Brenna, can you maybe tackle this one? Employees who want to continue working remotely or not return to work at all because of their own or their child's underlying health issue.
Yeah, I'd love to. And what I will say is that I'm going to answer it based on just assuming some variables, because there really are a lot of variables that could throw this into different buckets. And I'm going to tell you that I'm going to answer one part, and then I'm going to give my peer Brittany a heads up and pull her in toward the end of this one, because this also applies to some unemployment stuff. And Brittany really has done a ton of work and is kind of our team expert on the unemployment world. So in the world of working remotely, some of the things, the first question would be, were they working remotely this whole entire time and so they want to continue working remotely? Or have they been in the office and now they want to start working remotely? Were they furloughed? If they were furloughed, and then you call your workforce back and they say, hey, instead of returning from furlough and returning to work, I'd like to stay home. Those are kind of three different scenarios. So the question would be, first and foremost, is looking at, okay, is this person furloughed and I'm calling my workforce back, right? So were they on leave? Maybe they were on leave or furloughed because they have an underlying health condition, and now we're saying, hey, I just need you to come back. Or they're saying, hey, I don't want to be on furlough anymore, but I'd like to be working remotely instead of returning to the office, right? So that's one question. And on the HR side of that, not looking at the unemployment response, the question is going to be, you need to look at each individual person's situation. So what is the role they're in? What is your business? What are the essential functions of their job? Every HR person's favorite phrase, what are the essential functions of your role, right? So that sounds so basic, but sometimes in the world of COVID, it's easy to forget to go back to those HR basics. And you do just want to go back to the HR basics. Okay, first of all, does the employee say, hey, I have a doctor's note that says I need to work remotely, or I can't go into the office, or I can't have any exposure whatsoever because of an underlying condition under the ADA or the MHRA? So you need to have that. Is it their own underlying condition, or is it somebody in their families? Because those are two different buckets, right? So if it's somebody in their families, the hard answer is that that really might not qualify under anything under the ADA or the MHRA, right? So this isn't a leave. That would fall into a totally separate bucket. You can see how this is just a big spaghetti bowl full of like which one's through, and why we spend so much time with clients and employers talking through these questions. So I would say start with each individual one and looking at, are they currently furloughed, and is this about returning to work? In a moment, Brittany's going to tell us what you should do in that situation. If it's not that situation, and they've either been working remotely or been in the office, and they're asking essentially for an accommodation for their own health condition, then you need to review, is this a role that can be done remotely? Is this something, how much of their role, can all of their job, can none of their job? And if the answer is, hey, none of their job can be done remotely. So let's say they're an on-site maintenance technician. You have a big shop and they're a maintenance technician who does work, and there's nothing that they can do remotely. But you go through the process and determine they do have a qualified underlying health condition. They are at higher risk if they were to contract COVID. They have the medical note saying, hey, all of these things are the situation. A lot of employers are saying, hey, what I can offer you as an accommodation is an unpaid voluntary leave of absence, right? So instead of saying, hey, I can't accommodate that in a previous world where maybe they would just have a voluntary resignation, they're saying, I'm willing to offer you a non-job protected, unpaid voluntary leave of absence because I understand this is a situation that you don't have control over. So there's a lot of ways this could go. Brittany, I would love if you could talk to all of us about, what do you do if somebody's been furloughed? They've been on furlough, and you're calling your workforce back and saying, hey, our business has increased. We're going to have our next round of people coming to the office. And they say, well, I've been on furlough, but I have an underlying health condition and I can't come in to work in the office. So I either want to work remotely or I just can't return. What do you do then?
One thing to keep in mind is that if an offer has been made to an employee and they refuse that offer, as an organization, you're obligated to report that to unemployment. So make sure that you're reaching out through your employer account. You know, if they've been furloughed, then they have already made a claim. So you can look them up on your employer account and then have that documentation. So you're going to want to have a written return to work offer. You know, if they've been on furlough, they're coming back. Okay, effective this day, we're asking for you to come back. Here's the details. And if they refuse that, it's nice to have some documentation on refusal, whether it's an email thread or you know, if they verbally tell you, then just document that and then make sure you're reporting that, because you are obligated to let unemployment know.
Great, thank you. And I think a common question that we all get is somebody has an underlying condition, they can't return from furlough, or they need to continue working remotely, whatever it is, and they say, I can tell them that they're covered by unemployment, right? So they don't need to worry about money. And it's a big red X. So what I would say to you, if I had like a X button, I'd hit it and it would flash on your screen right now and say, your role as HR, even if you feel super confident that you know the answer is yes, to say, ultimately, your eligibility for unemployment is solely in the hands of the state when you file for unemployment. So as an employer, all we do is notify them of your employment status, right? So when you're furloughed, we notify them through the system and say you're furloughed. If I call you back to work, I have a legal obligation to notify them. I've offered you work, and then you have the right to then say, hey, here's why I declined the work, and the unemployment office will determine eligibility. So it's really important. You just want to stay out of saying somebody is or is not eligible, even if you feel really confident on it, because it's completely out of your hands whatsoever. So just say, hey, go to their website, there's FAQs on there. We just want you to know, as an employer, I have a legal obligation to notify them whenever I change your employment situation. And even if you decline it for a reason that I think is qualified, that I think leaves you eligible, I still have to tell them why your eligibility has changed. So I'm going to notify them and you'll get something in the mail.
Yep. Very good. I want to jump in front of this question. We've had a lot of questions really kind of focused around the, can I require an employee to provide proof that their test came back negative, and or can I require any employee who I may think is exposed, or can I require anyone to go get a test? I mean, I can take that one. Anybody want to field the requirement question? As far as the negative test, I'll speak to that one. So no, you can't require an employee to provide you proof of a negative test. Couple reasons. One, some employees aren't getting test results in a manner that's documented. Initially, people were getting phone calls and those types of things. So I think one of the things we have to sort of take a step back at times and think about is, had you not known that, so if the employee is not symptomatic, you're not aware of direct exposure, and they're telling you that they're released to come back to work, hopefully you have good safety and hygiene protocols in place in the workplace, and that employee should, in theory, not be any more of a threat than any other employee in your workplace.
Yeah, I would add, yes, you can't require, but you can ask them.
Oh, yes.
And sometimes I think we get, so what can we, can't we do? But you can talk to your people and you can communicate and just say, I am so glad to hear that. I care about the safety of all the employees at the workplace. Do you have anything that they gave you? You know, and then in my experience, they will just send you the text message, the email, the document. So just talk to them.
Yep. How about requiring other employees in the workplace to go get a test?
Oh, no.
Yeah. No, I think you can absolutely say, hey, I would like you to call if I know. So if I have an employee who tells me I have a positive COVID-19 test, I went to the doctor, I got a test, and I follow the steps that Tamara and Megan laid out, and I determine that Jim worked next to Bob for an 8-hour shift, and they were within 6 feet of each other, and I know that Jim I don't require masks, I recommend them, but I know Jim is anti-masks, he doesn't want to wear one, right? So that I can say to Bob, hey, what I would like you to do is call a medical professional and get a recommendation, right? So I'm not a doctor. I would like you to contact your medical professional, a medical professional, and get their input on what next steps you should take, right? So that it's easier to say, hey, I'm not going to make the decision for you, but because of our workplace response plan, I'm notifying you that somebody that I know you've had meaningful contact with has tested positive. So I do need you to contact a medical professional to get, and let me know what they tell you, what steps you should take, if it relates to coming to work or not coming to work.
This is a great time to use that partnership with the health department as well. So an example, 2 employees, you could have completely wide ranges of responses. So one is panicking, and I obviously have COVID and I passed it on to 1 million people and I'm terrified. And then the other one, which will surprise you when it happens, the employee says, I figured I was gonna get COVID anyway at some point, so might as well be now. And you're going, okay, now I'm panicking because you're not panicking and I feel like you should be panicking, which is a funny reaction that you'll find you have. And so that person, you know, again, I can't tell them to go get tested. The first person's gonna absolutely go. Like, they're like on their way, they're in the car, they're going, right? There's no problem with that. But you're gonna run into that person who's just like, it's not even that they don't care, it's just a different response to it. And so in that case, fortunately, you can use the health department if they've reached out and just say, hey, you know, I'm not a medical provider, reach out to the health department, because the health department can do more of that and can say, hey, you really should go get tested. And so lean on them when you can and use that partnership that we don't usually have the opportunity to do, to prompt some of those employees to go where you can't do that as well.
We are right at 10:02, but our team will stay on for another, let's just wrap, we've got a few more questions. We'll stay on for another 5 to 10 minutes here and try to tackle these. So if you need to jump off, thank you so much for joining us today. As we mentioned, we'll be sending out all the slides. If there's any questions we don't get to during this next 5-10 minutes, we'll make sure to get those out to the group as well. And there will be a recording of today's session that we'll send out post-session as well. So thank you so much for joining us today. I think, you know, our team in this current environment, it's just so dynamic and changing, and we really recognize that a lot of HR professionals, especially those in organizations with under 100 employees, a lot of this is just very, very challenging. Many of us feel like we're a little bit on an island trying to sort through all of this on our own. And so just know that our team is working with clients, old and new, non-clients, constantly helping them build processes, policies, be prepared, work through these specific situations. So don't ever hesitate to reach out and contact us. All of our individual information is at both the beginning and the end of the presentation. So if you need to jump off, thank you very much for joining us, and we'll tackle a few more questions here if you have time to stick around. So if we have a positive case, and I think this is a really quick answer, Tamara, because you touched on this, but do we have to close?
No, short answer is no. So again, back to OSHA, more guidance than requirements, right? But that's a decision that you're gonna have to make. And it's one that I would think through. Again, we've talked about this, but think through with that plan, how you wanna tackle that should it happen.
Mm-hmm. And some of it is, you may not have to close, but you likely have to take some sort of cleaning and disinfecting measures. And so just depending on the nature of your workplace, if you're a 24-hour facility, yes, you may need to close long enough to get the cleaning done, and then you'd be able to reopen. If it can be something that happens overnight during non-business hours because you're a typical 9-to-5 office environment, that's a totally different situation.
And again, refer back to the CDC guidelines on that. I mean, it really is helpful. You know, there's suggestions as far as, you know, if you can close and open all the windows and let some of that in, so to make it healthier and safer for the cleaning staff that are coming in to do that, that's better. So really rely on that and just have a plan ahead of time so that you know what that is and you're not panicking.
Great. very common one. Brenna, you touched a little bit on the FFCRA exemption. So this is a question we're getting a lot. There's a lot of factors to this, but very high level, and then maybe Brenna, you can speak to what this sort of means in real life, right? So the FFCRA does allow for some exemptions to both the emergency paid sick leave and the emergency family leave and the extended FMLA leave for employers who have less than 50 employees and who can document and support that complying with FFCRA would jeopardize the ongoing viability of their business in some way. So speak to, I think and you touched on this exemption applies. We are seeing virtually no employers taking advantage or claiming this exemption. Speak a little bit to why that is, Brenna.
Yeah, I think it's funny, whenever we get this question, we go back to two things. One, the intent of FFCRA, and really primarily the intent of the emergency paid sick leave. And two, kind of the question, we answer a question with a question, which why wouldn't you? And so the intent of the emergency paid sick leave, particularly under FFCRA, is because ultimately if somebody has been exposed, has COVID, has the symptoms, we don't want them to come into the workplace and to spread that. And so if as an employer you say, hey, it's a business hardship for me not to participate with FFCRA for emergency paid sick leave, what you're saying then is then you're not going to pay your employees who are out sick, and then they are going to come into work and spread it. And so ultimately, under the emergency paid sick leave, that first 80 hours, I have yet to have a client, an employer, anybody say, this is what we want to do, particularly because if they have COVID-19 or have been exposed, they're not going to be at work anyways. So they're not going to be at work helping your business, regardless of if you have FFCRA. So the only reason, if you didn't participate in FFCRA, then you would essentially just not be picking up free money that's already out on the table for you to pick up. So expanded FMLA is a little bit different in that you might say, hey, I can't have somebody out for 10 weeks because my business can't sustain that. That's a little bit different. But the emergency paid sick leave, where they're not going to come to work anyways, there really isn't a reason that you wouldn't have them exercise that. And I did see a couple of questions in the Q&A that kind of fall into this bucket around, well, what if they're not eligible? Well, it's like a 0.001% of people are not eligible depending on when they were hired, because remember, FFCRA, if you've worked really at all, you're covered under the emergency paid sick leave and you're eligible for reimbursement on that. So you're not out any money for that. You really will get that reimbursed through Families First and your payroll tax credit. And if they don't meet any of the other requirements, ultimately, if let's say they call a doctor and a doctor says, no, you're fine, you should go to work. And they say, well, I don't want to go to work. Then that would be just all your pre-COVID rules, right? So you would just go back to pre-COVID rules. So if it's COVID related, you're in FFCRA. If it's not COVID related, then you just treat it how you would treat anything else. Where if somebody says, hey, I'm having a bad day and I just don't want to come to work today, then you say, okay, well, either you have PTO or sick time available or you don't, and I'm going to handle that the way that I would in another situation.
Yep. Important note for a lot of our government clients on the call. Public employers, not eligible for the FFCRA credits, also not eligible for the under 50 employee exemption. So while we talk about, well, why would we not pay it? You're guaranteed this reimbursement. There's really no financial impact to doing it. Public employers, we recognize you don't get the reimbursement, but you also don't get the exemption for the under 50. So tied to FFCRA, and maybe Megan, you can take this one. We did have a question that just said, hey, what about a situation where we have an employee who uses 40 hours of their emergency paid sick leave? The question is that a one and done, or could they have another qualifying emergency paid sick leave later in the remainder of 2020 and use up the other 40 hours?
Yeah, we were just having this discussion yesterday, so it's funny. And what we landed on is, again, to be flexible. That is, what we see as a bucket, for them to use, an 80-hour bucket. And so that's where your tracking comes in. But I mean, what I would do, and my team can chime in because we all have different perspectives, is to give them that 40, and then that 40 is sitting there in a bucket if they need it again throughout the year.
Yep. Yep, I agree. That 80 hours is combined emergency family or emergency sick, used in any mix, conjunction. It can be used intermittently and in different periods of time as long as those separate instances qualify. So it is not a one and done. All right. One quick thing I will throw in at the end too. Hopefully many of you have heard, and it kind of ties back to our FFCRA question. The IRS did release within the last week that they will be requiring that all FFCRA payments be reported on the W-2 form for 2020, or reported with the W-2 form. And they even go as far as to say each type of leave must be specifically itemized out. So what was the gross payout under the emergency paid sick leave? What was the gross payout under emergency family leave? And what was the gross payout under the extended FMLA under FFCRA? Those have to be itemized out either in box 14 of the W-2 or in a separately attached statement that goes with the W-2 to each employee. This just leans again on making sure that you have systems and tracking mechanisms in place on a per employee basis that you're going to be able to get to the actual gross dollars paid to each employee under these types of leaves. So at the 100% regular rate, 2/3 regular rate. So just another reason that your internal systems and processes need to be really clean and easy to dig that information out for that annual reporting.
Hey, Leah, can I jump in on a question here that I saw at the bottom? And I was just going through Q&A, and there's a really good one that I think we're going to see come up a lot more around masks, right? So it's everybody's, at least every HR person, when they get an email with a subject little mask question, everybody's like, oh no, well, let's see the answer. So I think what we're hearing a lot about, particularly as cities implement requirements around masks, right? So we have the federal government, the state, the city, and an employer. Each can choose to implement a mask requirement. And then, of course, employees then have the right to respond to what that mask requirement is. So kind of the primary question, there was a couple asked a couple different ways. So if you as an employer require masks and or a city that your business operates in or your organization operates in requires a mask, the questions are, do you need to notify people? Yes, you do. So if you are a public space that you're requiring it, if you're a municipality that the municipality has required them to already have masks, there's some gray area on the signage, but I think just helping people. But the primary question is, what if I have an employee who requests an exemption from wearing masks? And the answer is that would be an accommodation request, just like every other accommodation request that you get. And so if somebody says, hey, I can't wear a mask for XYZ, then you need to say, okay, you need to provide me with a doctor's note that says why you can't wear a mask, and then we'll determine what our accommodation options are. So if someone says, hey, I refuse to wear a mask, I'm just going to work from home. Well, unless you already have a work from home flexibility setup structure. So for example, you already say, hey, our offices are open, but if you want to work from home, you can. If you're in the office, you need to wear a mask. Fine, they can work from home. If everybody has to be in the office and they say, hey, I'm just going to work from home and not wear a mask, then that's a different question. So then you need to be reviewing, well, everybody's in the office, so that's an exemption to wearing a mask. You need to provide us with a doctor's note about why you can't wear, that you can't wear a mask and what our accommodation options are. And then ultimately, when somebody does provide you a doctor's note, there's a question about somebody won't come into work, but they'll go to the gym. They won't do this, but I know they're traveling. And this is hard for employers across the board. I've been in HR 20 years, and this has never not been hard. That when an employee provides you with a doctor's note that says they can't do something at work, and everybody knows, because there's these little things called Facebook and Instagram and Snapchat, and employees know what everybody's doing, and so-and-so won't come to work, but I saw them jet skiing on Saturday with 15 friends and whatever it might be. That our role as an employer is just we have the information the employee gives us. If we want them to come into work and they give us a note saying they can't, and we've determined we can accommodate with work from home, then it is what it is. and to just continue to pull yourself out of the weeds on that, because there's no win there, right? So work with the information that you have that's been provided to you, and work hard to stay out of people's personal lives and decisions. And I know that that's really hard, especially with how exposed people's lives are on social media platforms. But just stay focused on what information you've been provided, and don't seek out more than you have. And even if you have more than that, don't get caught up in responding to that. If they've already given you a doctor's note, you just need to work with what you have.
All right. Well, I think we addressed most of the questions that came in from the panelists. There's a couple, I think 2 or 3 that I think we can respond to post meeting. And again, we just thank you all for joining us today, and hope we can be a resource if you have any challenges, issues, or questions as we move forward. So thank you all for your time this morning, and have a great weekend.
Thank you.